All right, today was a busy one for members of the Obama administration. They laid out key components of their regulatory reform plan in an op-ed in the Washington Post, and then the president was in Chicago pitching his health care plan to a group of doctors, a group he'll need in his corner if he's to get his proposal passed. For more on both, we are joined from the White House by Christina Romer, chair of the President's Council of Economic Advisors, and I'm also joined by my own economic advisor, Kathleen Hayes, here on set. Christina, thank you so much for joining us. Let me ask you, first of all, how the speech went. I mean, how did the AMA react to the president's speech?
I think they reacted very well. I think, I have to say, having read the speech several times this weekend, I thought it was fantastic. I thought he was so specific. I thought he put out a vision of how we were going to do this that I just thought was off the charts.
So one of the things, one of the top things that we covered here at Bloomberg is that the president said, well, the cost of malpractice lawsuits is a real issue for doctors. He won't support capping damage awards, but it seems like the malpractice problems are one of the main things he wants to remove here. Why won't he support a cap for awards then?
I think what he was saying is there is a middle ground, and he was certainly opening up a door that we can certainly think about the fact that doctors are facing some constraints coming from malpractice. What he was trying to do is to put out a whole vision of how we can take the healthcare system that we have, keep what's working well, but fix what's broken. And that was certainly what he was talking about.
Christine, I interviewed today Richard Fisher, who's president of the Dallas Fed. And one of his big concerns, like so many people out there, is the budget deficit. And, we've got entitlements looming, but paying for health care reform. Remind us how you're going to do this. Any whiff of a deficit that gets monetized by the Fed is alarming to U.S. and global investors. How do you reassure them when you're tackling something like health care in a deep recession?
The crucial thing that the president has said is comprehensive health care reform is the #1 thing we can do precisely to get the budget deficit under control. I mean, if you look, any of the studies by CBO will tell you that the thing that is causing our deficit to have trouble, especially going out 1-2 decades, is the looming rise in health care costs. And what the president is talking about is putting in comprehensive reforms today that we pay for absolutely everything in the short run, and we put in those reforms that are going to slow the growth rate of costs over the longer run. And absolutely, the CEA just did a big study that showed if we can do this, if we can genuinely slow the growth rate of costs, we can absolutely have that budget deficit not going up, going down instead.
Can you do that in a way? I mean, there are obviously countries that have national health care systems. Great Britain is one, Germany is another, and they're both really bad if you look at the health care itself compared to the kind of health care that you can get here. Can you do that in a way, speaking of the American Medical Association, that keeps health care in the U.S. really at a high?
Absolutely. What the president has said from the beginning is we're going to work with the American system that's different from those European countries. But, again, I'll come back to the CEA report, because one of the things that we documented, looking at lots of evidence, is just how much inefficiency there is in the American system. Researchers put it at some place like 30% of healthcare expenditures are basically wasted. That's about 5% of GDP. What that says is you can do a lot of slowing of the growth rate of costs without having any impact on quality. And in fact, one of the things that the president's been talking about is a lot of the things that we want to do may actually improve quality. And so we think it's just crucially important and absolutely possible to do.
Quickly, Christina, and as we wait for the president to lay out his blueprint for financial reform, what camp are you in? We hear so much talk about more regulation and more regulators. Some people would say just set new rules so banks cannot get into excessively risk-taking activities that cause another financial crisis. That's the answer. Not more regulators, not a new big Uber regulator, anything like that. What's your position?
Well, I think the main thing I'd like to put sort of in perspective, the president doing financial regulatory reform, healthcare reform, is how it's all part of his general idea of having us get through this crisis and then be a stronger, healthier economy. And that is absolutely what he is aiming to do. On the financial regulatory side, I mean, we absolutely want to make sure we don't get into the situation again. And one of the things I think we realize is that there was a hole in our safety net where there were new markets coming up, new instruments coming up that nobody was paying attention to or that didn't get covered by regulation. And that's one of the things that we're going to try to fix.
All right, Christina, thanks very much for that. We've made a lot of firsts here. We put the first people on the moon.
Yes.
Maybe we'll be the first large country to establish a working national health care system.
We're Americans.
Yes,
we can do it.
absolutely.
Isn't that the idea?